So in this video, we want to explore a little bit more your timeline again. And we talked about that in the first video in these series about kind of looking at your current symptoms. And this is just really delving into that a little bit more deeply now that you've got a little bit more knowledge about the situation, and just starting to pick out and see what might be relevant to your symptoms. And we're going to do it in a slightly the other way around this time, where we're going to go back and think about your life, essentially, your timeline, and then put the symptoms in. Oh, actually, do you know, when I was 4, I remember that I broke my leg. Or when I was 16, actually, I had some really bad eczema. And so it's kind of looking at it the other way around, rather than looking like, oh, that's not anything to do with my symptoms currently. It's about turning it around and seeing whether there is any links back further than you thought, and whether there are more things in your timeline that actually could be relevant. So this change of pain symptom timeline worksheet, again, is included in this module, and you can spend some time just filling that in. And again, it's got the columns the other way around. So noting sort of the issue or the event, it doesn't matter how big or how small, it's about, actually, do you know, that was significant? And then just writing again if there's any symptoms that seem to be particularly linked with that, or anything that's came from that. Oh, actually, do you know, I didn't have this symptom prior to that event, and I did have it afterwards, even if it didn't come on, you know, directly as a result in that moment. You know, we only have to look at, for instance, something like shingles. Now, shingles is the residual chickenpox virus that sits in the nervous system. And more often than not, it is a shocking event later on in life that means that the shingles then becomes undormant and is displayed. And it's, you know, there's now quite a lot of research into that. And so what we know now is that actually shock and stressful events can have physiological changes on the body. So what we're doing with this worksheet really is trying to get an idea of how that's affected you or not. The second worksheet in this section is a history of stressful events in a bit more detail. So if you fill in the first one, and you might have missed something, this one gives you a few more prompts. You don't necessarily have to do both, but and you will find that there's crossover between the two. But if you put these ones in, then you might find actually that they're, you know, this one gives you slightly more cues, if that makes sense. And it does cover things like, you know, traumatic events or pressures during childhood or during your teenage years, change in family units. That could be, you know, loss of a parent. It could be a divorce. It could be, you know, a blended family. You know, you living with stepbrothers and sisters, half brothers and sisters. It does look at things like accidents and injuries. So again, all of the factors that may have been important in your life and pain story. Again, as we get a bit older, you know, change in a relationship or marriage, we know that when we are in a sort of more stable environment in our home, that actually this is a resource, this is a positive resource for our stress response. And essentially it means that often we're less stressed. And when we have a change in that, it can be very unsettling. And it actually then means that we often will hit that stress response a little bit more quickly. So all these factors are important. And, you know, and if you've got lots of them in your backpack, then, you know, that's important as to why you may have pain now. Now, just when we start talking about these things, sometimes it can be quite triggering and it can be stressful. So as we've mentioned early on, what we want you to do is just to look after yourself as you do these worksheets. Just make sure that if you find yourself feeling a little bit triggered, that you take a few deep breaths. You possibly use the havening technique when you stroke the upper part of your arms, just to keep yourself settled. Because you know, suddenly we are starting to dredge up things that might be a little bit triggering. And again, always, if you need assistance, then make sure that you reach out to somebody, either to us or to somebody who you know and trust in that environment. The the difficulty of, as I say, of an online platform is that we aren't there right in the room with you, supporting you. But so do please make sure that you take care of yourselves as we go through these things. And the reason that we're doing this is as we go forward to try and sort out our chronic pain situation, sometimes we have to go back and reframe or relook at or process some of the things that have happened to us in the past. Now, this is not necessarily a deep sort of psychological therapy, although sometimes actually that is indicated, and you know, we would advise that you seek professional help in that area. But actually, sometimes it's just enough to go, oh gosh, yes, and then we had to move. And actually, and you know, when I was 4, the dog died, and actually I found that really distressing because the dog was my best friend. And it's just suddenly then being able to see the picture of the overwhelm. And so essentially that's what we're looking for as we go through these couple of worksheets, is to sort of see what's going on. Because as I say, we know that the safer we feel, the more settled we feel, actually the better our nervous system functions and the less pain we're likely to have. So again, the form is fairly self-explanatory, but it is that just looking through those experiences that you might have had. As I say, as we move on to this second page, you know, do be cautious as you, you know, because the next 2 sections are sort of things like violent experience and sexual difficulties and relationship difficulties and things. So just be, as I say, cautious with yourself as you answer these questions, and make sure that you're staying in your body, and make sure that you notice any emotions and any things that come up, and maybe make a note of those in the any other factors section of the sheet. But just, yeah, keep yourself centered, keep your feet on the floor, keep yourself grounded, just as I say, in case that you're feeling a little bit wobbly as any of these things come up. As I say, when things do come up, what we will then do later on is to give you the sort of techniques and tools and things to work through. And we know that often things that have happened as far back as childhood are really important. And why this is important is because essentially, if we have some sort of fight or flight response as a child, and that is not regulated by an adult properly for us, then actually that can change the way that our nervous system works ongoing. Now, sometimes that happens in our memory. Sometimes that happens sort of when we are cognitive and we do understand it and we can give it story. And sometimes that can happen precognitively. So it may be that there has been something that's happened before you even really remember, but you know that there's been stressful events in your past. So essentially, we do know that these early experiences are important. And in the next video, what we will cover is talking about adverse childhood experiences and relationship and things that have happened with family. And again, we just want you to take care as you go through those worksheets to see how you go. We will be having fortnightly webinars where you will be able to ask questions, and we will be able to support you a bit more in those areas, but we aren't able to answer very specific questions just on email. So if you feel you need the support of somebody, we either offer support from our clinic, Osteopathy for All, or we recommend that you seek out a SERPA trained practitioner. On the support page on the website, there's all the details of people that you can get in contact with if you need a bit more support than doing this on your own.